Dental caps versus dental veneers. How to choose? If you are given an option of choosing one between a cap or a crown versus a dental veneer, then how would you decide that what is better for you? What are the pros and cons of each of them? Let's dig in deep into caps versus veneers. So hello everyone, I am Dr. Ankit from Seraphic Dental, Indore, India. We are situated in central India and we have been practicing aesthetic dentistry, dental implants, facial cosmetic surgeries, hair transplants since more than a decade now. And in this video, I am talking about selecting one between dental cap and a dental veneer. So see friends, we do put on caps and veneers for various requirements like giving strength to our teeth or repairing the chipped teeth or correcting the discoloration of the teeth. We want to make them look white, we want to make them in good alignment, we want to correct the chip part of our teeth, and we want to replace our missing teeth, we want to put teeth in bridges, we want to use crown over dental implants. So there are multiple indications, multiple situations in which we need a dental cap or a crown. And the same goes with veneers also. Veneers generally per se, we more talk about veneers when we talk about aesthetic or beautification treatments or the cosmetic dental treatments. Sometimes there is a situation in which we can go for both of these in dental caps also and veneers also. So many times a question arises in such treatments that do we need a dental cap or a crown or a dental veneer? What should we go with? So let's understand the difference between both of these. A dental crown is supposed to cover the tooth from all the sides. It comes over your tooth and sits like this. Whereas the veneer is covering your tooth only from the front side. If this is your tooth, the veneer will come and sit here like this. The veneer will cover up the tooth from the front side, but not from the other three sides. So this is the difference between a crown and a veneer. So what is the advantage with veneer? What we are getting with veneer is that we are not touching the other three sides of our tooth. We are just working on the front side. So the other three sides are preserved. They are natural. They are as it is. No one is touching them. You are not drilling them. You are not preparing them. You are not trimming them. The other three sides I am talking about. So minimally invasive this treatment is the veneers. Only the front part is being addressed. All the other three sides are being preserved natural. So this is the beauty of veneers, that you preserve maximum natural tooth substance. Whereas on the other hand, for crown, you have to prepare or trim all the four sides of your tooth. As compared to veneer, the other three sides, the back one and the sides are also being prepared or trimmed. So now the question arises that if veneer is giving you that advantage of preserving maximum natural tooth structure, then what is the need of crown? Why are you going for a crown? We want to preserve our tooth maximum. So answer to this is that friends, the crown will give more strength to your teeth. The crown is covering the tooth from all the four sides. It is sitting on your tooth like a helmet. Whatever you eat, all the load will be bared by the crown and your tooth inside will be always safe and protected. So this is the beauty with crown, that it is supposed to give you more strength than veneer. So are veneers weak or are they less strong, or does this mean that they won't last for a good time? That is absolutely not the case. Even the veneers would last for years and years, many years. You don't have to worry about the longevity of veneers. But the thing is that there are certain cases in which the demand of the treatment is such that you need to cover the tooth from all the four sides. So you have to go for the crown. There are certain cases in which veneer are not suitable. So the selection of the case is the most important thing in this. That if your dentist feels like that veneers are sufficient, they'll give you good look, they'll maintain all your arch alignment and harmony and balance of your teeth and whatever you want, all the things will be addressed with that. So you're good to go with veneers. But if your doctor feels like that you need additional support, then that thing will be decided at the time of treatment. And if you are going for the crown, then you are going for the crown. Then you don't have to think that, oh, I'm not able to get the veneer done. It is not like that. If crowns are good for you, caps are good for you, more strength is required, you go with crowns. Aesthetically, you will get the same result with crown also. But if your case demands more strength, then you have to go for crowns. Secondly, if your case demands splinting, then also you need to go for the crowns. Suppose we are getting veneers done for 6 teeth. Your upper part, upper jaw 6 teeth, in which the portion which is visible when you smile. So in this part, when you are putting veneers, so you are putting individual veneers on all the 6 teeth. They are not joined. Veneers cannot be joined. This is the typical technical property of that thing, that veneers are supposed to be individual only. They are not joined. Whereas in the crowns, you have the privilege that if you want to join them, you can join them. You have that flexibility. You have that option with you that I want to connect all these 6 teeth. Then you can connect them very easily with the crowns, and then they are made up of a common framework. So what you get out of this is that they bear now more strength. They are splinted to each other. So whenever someone bites on these crowns, then all of these 6 crowns will take up that biting force jointly now, and no one single tooth will bear that brunt of chewing. So all the load will be distributed on these 6 crowns, and your teeth will be splinted and safe and protected. So these are the indications and differences between veneers and crowns. So the take home message with this video is that aesthetic result out of veneers and crowns will be same. Treatment time required will be same. The cost will also be almost same. If you go for a good quality zirconia crown, then the cost will be similar as that of a veneer. So cost is also not much of a deciding criteria. The only deciding criteria is that whether your teeth need to be splinted firstly. Secondly, that do you require that additional strength in that particular prosthesis which you are making, so that your dentist decides and then he prepares all the 4 sides and goes for a crown. So this is how you choose between veneer and crown. Ultimately, the choice has to be done by your doctor only. You have to choose a good doctor. He will choose that a veneer or crown is better for you. So I hope that I have made you clear that how to select between a veneer and a crown. Still, if you have any query on dental veneers or dental crowns, you please feel free to ask us, and we'll be happy to answer all of those. Thank you so much.